everyone. I'm Nicole and I'm the community advocate at Lifespin. Thank you for joining us today. Beside me, I have James, who is a student working alongside me for the summer, and he's helped me put together this workshop. We're hoping it's going to be very informative for you. At any point, feel free to ask me, feel free to ask me any questions. I don't want you to wait till the end and then you forget your question. So just jump in at any time in the chat or through the speaker. I am recording because this is going up on our website, but I will stop recording at the end in case you would like to ask any questions or have some discussion. Okay, so here we go. Health benefits workshop. So these are the different topics we're going to be covering. A lot of them I'm sure you guys already know about. Maybe some of them will be new to you though. And we're hoping that if there's anything that is going on with your health, that maybe these different areas of topics might be able to help you access different resources and benefits or programs that you didn't know about. So first, we're just starting with the base, which is OHIP. So this is a government-run program that pays for a wide variety of services. And I believe anyone is covered under OHIP once they have a health card. So under OHIP, family doctor visits are covered, walk-in clinic visits are covered, visits to emerge are covered, medical tests, diagnostics, and surgeries are also covered. So to qualify, you need to be one of the following: Canadian citizen, Indigenous status, permanent resident, applying for permanent resident in Ontario, have a work permit in Ontario, are a refugee or protected person, have a temporary resident permanent, or be a clergy member. So it covers Ontario citizens for a few stipulations. You have been in Ontario for a 12-month period, 150 days in a 12-month period, have been in Ontario for 153 days out of 183 days after moving here, and Ontario must be your permanent province of residence. So steps for getting babies on OHIP is different. You must fill out an Ontario Infant Health Coverage registration form. These are not online. I believe these are given to you in the hospital after you give birth, but either way, you might be able to get one from a Service Ontario. They could mail one out to you. You could go in person and pick up the form. So we'll start again. Our second topic is ODSP, Ontario Disability Support Program. So this is a government program that provides a number of benefits that are not limited to financial support. There's a lot of health benefits covered under ODSP and employments to support people who are living with disabilities. So ODSP covers prescription drugs that are on the Ontario Drug Benefit Formulary list. If they're not on the formulary list, this can be reviewed by the Ministry of Health. And there is also another program that can cover drugs that are not on the Ontario Drug Benefit Formulary list. And I will go over that program within the next several slides. So ODSP covers, well, we'll start with devices such as eyeglasses. These are covered under ODSP, as are repairs. You need to request a vision care benefit form from your caseworker and fill it out with your vision care provider. They can also cover hearing aids and the repair of hearing aids. And you'll have to get approval from your caseworker before you can get these hearing aids. And there's, it's double. So hearing aids and glasses are covered, and as are the repairs. So there's also, similar to Ontario Works, there are special diet allowances to assist those who are pregnant and breastfeeding. This is usually capped at $40 a month, but if you're lactose intolerant, it can go up to 50. And there's also special diet allowances for people who are not pregnant or breastfeeding, but they have special diet needs or concerns, such as lactose intolerance or any other health conditions that restrict your diet. They will provide you with a special diet allowance. You just need to ask for the form from your caseworker and then fill it out with your healthcare provider. So ODSP also provides coverage for routine dental care, and there's additional coverage for those whose disability affects their dental health. I think routine dental care refers to many things that are also covered under Ontario Works dental care, stuff like extractions for pain relief, fillings, cleanings. Are you sure? Okay, and dentures. There is also a guide dog benefit under the ODSP Act, and if you have a service dog, you are entitled to $84 a month to assist with the care of the animal. To get this benefit, you'll need to prove to your local ODSP office that your dog has been properly trained. And below are the authorized different training institutions that could help you be able to get your dog trained. So moving on to Ontario Works. So there's coverage for prescription drugs. They cover most drugs under the Ontario Drug Benefit Formulary. And again, if it is not, there is another program that you can apply for and get this covered, which I will go into. When you go into the pharmacy, you'll likely need to show your drug card, which is attached to your stub. And Ontario Works also assists with routine dental care. This is stuff like cleanings, fillings, emergency care for pain relief, and tooth extractions. Dentures are also covered. And if you're on Ontario Works and if you have children under the age of 17, they will be automatically enrolled into the Healthy Smiles Ontario program. This is the same for children under the age of 17 whose parents are on ODSP. Your children will automatically be enrolled into the Healthy Smiles Ontario program, which provides free routine care and emergency dental services to youth in Ontario. And we'll go more into that later. So Ontario Works is able to cover eyeglasses purchases and repairs for the eyeglass. I believe it's every 2 years. Okay, so if anyone has broken their glasses and it's been under a year since you've gotten them, they will likely not cover this repair. But there's special circumstances, of course. If you're ever in a situation where you don't know if your repair will be covered, or if they've said that your repair won't be covered, just come to me and we can discuss your options. Ontario Works also covers assistive devices such as hearing aids, mobility devices, prosthetics, respiratory devices, and more. If you want a full list, you can certainly come to me and I can make that list available to you. Now, OHIP covers examinations, eye exams for people under 20 and over 65. But if you're on Ontario Works, they will cover the cost of routine eye examinations once every 24 months. Like ODSP, Ontario Works also provides diet assistance and special diet allowances for people who are pregnant, breastfeeding, or who have dietary restrictions due to a health condition, or even something simple as being lactose intolerant. You could get a special diet allowance for that. And I believe the max is what, James, do you know the max for that?
The max was 40 normally and 50 if you are lactose intolerant a week extra.
Okay, so 40 usually, but if you're lactose intolerant or if there's special circumstances, it could go up to $50.
That's correct.
Okay. So now we're getting into discretionary benefits. Health benefits, some health benefits that you can get under Ontario Works and ODSP are actually covered under discretionary benefits. It's a little confusing. For example, this is one I get all the time. If I have a client who's on ODSP or Ontario Works and they need special orthotics, or orthopedic shoes. This is not something that ODSP and Ontario Works covers, but it is something that discretionary benefits covers. So there's certain health related items that aren't covered under ODSP and Ontario Works because they're covered under discretionary benefits. So if you're not sure if the health item or service that you need is covered under Ontario Works or ODSP, you can either ask your caseworker and they'll direct you to the discretionary benefits program, or you can come to me and I will do my best to figure that out. So it's discretionary benefits program is a division of Ontario Works, and it's a City of London initiative aimed at helping London residents with extreme medical need with financial aid. So different things that they can cover are dental care, vision care. These are for people that are not on Ontario Works or ODSP though, because Ontario Works and ODSP have their own dental and vision healthcare coverage. You will not qualify for it under discretionary benefits. But say if you're low income and you need help with dental care and vision care, discretionary benefits can certainly cover this. Usually they'll need some sort of estimate before you ask for the service or the item that you need. And it is approved once you put in an estimate and all the proper documentation are submitted. And if you need help with that, please do come to me. I do discretionary benefit applications all the time. Other things discretionary benefits can help with are funerals and burials, wheelchair and mobility devices and repairs, cost of completing medical forms, electric breast pumps, blood test requirements, chiropractic services, and more. So a lot of these things, you're going to need a doctor's note for the chiropractic services. I know that for sure. And likely with the blood test requirements too, and costs of completing medical forms, you're going to need a doctor's note explaining why you need these services or items, how long you'll need them, and a cost estimate of these items or services. Sorry, I'm just checking my chat for a second. Okay. Okay. Okay, so now we're moving on into the transitional health benefit. This is one that's fairly new to me, and it is for folks who are coming off ODSP into employment. So this health benefit can be used towards prescription drugs, dental benefits, vision care, and repairs for mobility and mobility devices. To access this benefit, you need to have the income exceeding ODSP thresholds. So the low income cutoff, you'll likely need to be over the low income cutoff to be able to get this benefit. You'll have to be employed, and you can't have health benefits with your employer. So if you have no health insurance or health coverage, you can certainly access this benefit if you're coming off ODSP and going to employment. So we have a link there to see more about eligibility. And if you are interested in this benefit or like to know more, please click on the link, or you can have a chat with me and we can talk about it. So next, we're going to talk about the Ontario Drug Benefit Program. So this is a program that helps people pay for a wide range of prescription drugs. You do not need to apply for this if you're over the age of 65. Some people who are younger than this age can be eligible if they're receiving benefits from Ontario Works or ODSP. You could also be covered if you're under the age of 24 and you're not covered by any private insurance, or if you're not in social assistance, you could be eligible for this program as well. So drugs covered under this program are a part of the Ontario Drug Benefit Program formulary. It's over 5,000 medications that can be covered. And you can search up if your medication will be covered or not using this link. Okay, going into the Trillium Drug Plan, which is a lot like the Ontario Drug Benefit Program, but I think there's some differences, right, James?
Yes, there's some differences.
So maybe James can go over this one.
Sure thing. The Trillium Drug Plan differs from the Ontario Drug Benefit Plan in that it mainly targets low-income persons. The drugs that are covered are the same and use the drug benefit formulary in order to cross-reference. You should apply for the Trillium Drug Program if you live in Ontario, have an Ontario health card, do not qualify for the Ontario Drug Benefit Program, do not have insurance to cover 100% of your drug expenses, and spend more than 4% of your household income on prescription medication. Pardon the dogs. The form for application can be found online at the link below. Moving on to the Exceptional Access Program. This program helps Ontarians secure prescription drugs not listed on the Ontario Drug Benefit Formulary. This is what my colleague Nicole here mentioned earlier. The Committee to Evaluate Drugs, CED, makes funding decisions on what drugs should be covered under this program. Requests for drugs to be covered must be submitted via the Special Authorization Digital Information Exchange, or SADI.
And yeah, this form is available online. You could just Google Exceptional Access Program to get the form, or you can certainly reach out to me and I can mail the form to you. It's fairly simple. You just need to take it to your doctor and they will fill it out. Oh. Okay, so the Extended Health Benefits Program. This is another one that's kind of linked with ODSP, and we'll go into that. So this Extended Health Benefits Program aims to support those with exceedingly high prescription drug costs or other medical expenses. And some of these benefits include prescription drug coverage, vision care, dental care for children, diabetic supplies, and benefits for assisted devices. You're eligible for the extended health benefits if you're no longer eligible for Ontario Works or ODSP income support because your income has went up. You must also have health costs that exceed that difference. When you come off OW or ODSP because your income has went up, you should automatically be transferred into the Extended Health Benefits Program. But I would certainly encourage you to be proactive and talk with your caseworker and confirm that this will be happening so that you don't lose any health coverage. Okay, moving into the assistive devices program. This is a program that covers for a wide range of assistive devices for people in Canada living with disabilities. So those who qualify for coverage regarding these mobility aids or any other devices under the program, you must be an Ontario resident, have a valid Ontario health card, be requiring this aid for more than 6 months, and not qualify for Workplace Safety Insurance Board, and not be a Group A veteran and qualified to receive benefits from Veterans Canada. So the assistive devices program does not consider income. If you are on Ontario Works or ODSP, assistive devices will cover 100% of the cost. If you're not on social assistance, but you're low income, they will cover 70% of the cost, and you'll be required to pay the other 30%. This form is online and it can be filled out online. It can also be, if you need help, I can certainly help you fill it out. Different types of aids that this program helps with include manual wheelchairs, power scooters, power add-ons, things that you can add on to your wheelchair or your scooter, positioning devices, forearm crutches, wheeled walkers, pediatric walkers, standards and strollers. And I think there is a lot more that's covered, but we couldn't obviously put it all on one slide. It's too much stuff. But the whole list can be found online. Okay, so yeah, they cover hearing aids. The eligibility is the same as the previous slide. So be an Ontario resident, have a valid health card, require aid for 6 months, and not qualify for veterans or workplace safety benefits. And the devices that you could get for hearing aids under this program include obviously hearing aids and FM systems. I don't know how to pronounce that. Cochlear implant replacement speech processors, bone anchored hearing aid replacement sound processors, and teletypewriters for the deaf or speech impaired. You can apply for a replacement if the equipment has gotten worn out and is not under warranty, or if your diagnosis has changed and you require modified equipment. And there is a different application for that, which we have put there, and also a link for more information about the hearing devices themselves. Okay, so vision.
Yeah, the eligibility requirements are the same.
Okay, so the same eligibility requirements. It can cover such devices as such as specialized glasses, magnifiers, audio players for reading books, Perkins and other manual braillers for writing, CCTV and computer-based reading and writing systems, white canes for orientation and mobility. And like we said previously, it's 75% of the cost, not 70. They will pay up to 75% of the cost for this, well, for any of them, if you're not on social assistance. And what is this? Oh, is this diabetic equipment?
Yes.
I can't see. Okay, so they do cover diabetic equipment, such as insulin pumps and other items. The full list again can be found at that link below. And the assistive devices program offers coverage for a wide range of other assistive devices. And like we said, the full list can be found at this link here. So dental programs, So there's a new benefit out and it's called the Canada Dental Benefit. And it's meant to help assist people with lower incomes with dental care. And it offers a payment twice per child. Do you know if that there's a time span of that? Like twice in the child's life?
I believe it is twice per the child's life under this benefit.
Okay.
I believe that's the case.
Okay. If anyone had any questions, you can certainly come and ask or research it a little bit further. But yes, they will offer two payments for your child for dental work, and these are the different amounts you get. The amount obviously is higher if you have more than one child. And you're eligible for this dental benefit if you have a combined household income of $90,000 or less. So the cutoff is quite high. The application is divided up into 2 yearly periods, with the current period being July 1st, 2023 to June 30th, 2024. So you could apply right now. In this current period, additional criteria you must meet to be able to get this benefit are the following. Your child has to have been born after July 2nd, 2011. Your child receives dental services in the current period. So they have like an appointment coming up within the year or something, and you need coverage for that. Your child does not have private dental insurance plan through your work or anybody else's, an ex-partner, things like that. Your child's dental costs are not covered fully by other programs they are in, such as Healthy Smiles. And you are the only parent guardian. You must be receiving you are the only, yeah, you must be the only parent receiving it. So if you and your partner are separated, you both can't apply. It has to be one or the other. You also, it's not on here, but you have to be receiving the child tax credit to be able to get this benefit. Filed your 2022 taxes, and you did not apply for this benefit during the last period. So you can apply for this online through the CRA My Account, and you can also dial by phone. And James has put up what do you call this thing? A QR code?
QR code.
A QR code. So you can scan that, and then where does it take you?
That will take you to the online application.
It'll take you right to the online application. So the Healthy Smiles program, I talked about this a little bit at the beginning. It's routine and emergency dental care for those under the age of 17. Services that the Healthy Smiles covers are checkups, cleanings, fillings, x-rays, scaling, tooth extraction, and other emergency dental care services. Like I said, if you're on Ontario Works or ODSP, your children are automatically enrolled. But if you're just low income, and you're looking for some coverage, you will have to apply online, or you can come to me and I can print out the application. I can mail it to you. So the Ontario Senior Dental Program. This program is for low income seniors, and it covers different services such as checkups, tooth repair, x-rays, tooth removal, anesthesia, treatment for infection, treatment for gum conditions, and I believe dentures. I'm not 100% sure, but you can certainly come to me and I can find out, but I believe they do cover dentures. You are eligible if you are over 65, an Ontario resident, and you have an income below 22,000 or combined income under 37,000. And you can apply using this link below. Oh, and we've reached the end. So I just wanted to say, if anybody is wanting to apply for any of these programs, but maybe you don't have access to a computer, you just can let me know, and I'm more than happy to mail you a paper application. That's no problem. My email is right down there below. And I also have my phone number listed there with my extension. Please feel free to write any of this down. And I'm in the office from Monday to Friday from 8:30 to 2:30. I can make later appointments after 2:30. If like say if you're working or if you can't get to the office before 2:30, just let me know in advance you'll need a later appointment so I can work that in my schedule. And I'm more than happy to have evening appointments if need be. Was there any questions or concerns or thoughts that anybody had?